My name is Holland Kendall. I'm president of Kendall Optometry Ministry, which assists Christian mission teams in providing optical ministry all over the world. Our mission is not only provide glasses to help the person read their Bible, but it also improve their standard of living. The purpose of this video is to demonstrate the effective and accurate use of the Retinomax2 handheld autorefractor. Okay, I'm going to show you the handheld autorefractor and give you several views of it. So you'll want to zoom in on this. Okay, first of all, whenever the autorefractor is not in use, you want to keep it stored in this cradle. It fits like this in the cradle. Okay, keeps it from sliding off the table. Now, there are several buttons on this instrument. This is the power on-off button. And there is several buttons here that you don't use. These two here you're not going to find any use for. There's the right-left button, and then there is the print button, which is used to transfer the measurement you make of the person's eyes to the computer. I'm going to power on the unit right now. And then you can actually see it comes up by default set for the right eye. Now when you're using the instrument, always keep the neck strap around your head, unlike what I have right now, because I'm trying to hold it to show you how it's set up. There's also, in the front of the instrument, there is a lens, and the lens is the lens that you position over the person's eye. These two lenses on the side are meant to detect left and right eye. However, we don't configure the instrument to operate in that mode. Also, if you look down on the top side of the instrument, there is a groove, there is a mark on the top of the instrument. There's also a notice about using the neck strap. That mark, along with the mark that's on the side of the instrument, creates a crosshair that is used to position the instrument over the person's eyes. So therefore, when you start positioning, you're positioning their eye over this mark, and you're leveling it up with this mark on this side. There's also a start button that you can see here, which is used to start the measurement. And there's a battery chamber, which I usually put Velcro straps over because it has a tendency of sliding off like this one's doing. And it keeps, there's the battery is inside there. Your manual that comes with the kit shows you how to change the battery. Okay, let's pause for a second. Okay, the cable connects to it basically this way. Whenever you pull it, to remove it, first of all, you have to pull this little sleeve. And you can't pull on the cable and remove it like this. You have to pull the sleeve and grab the sleeve and pull on it, and the cable comes off. There's a little sleeve along the side of it. When you want to put it back in, you push it up against the instrument and you rotate it left and right, and then at one point you feel it drop in, you push it and it clicks, and it's solid. You also have this alignment view, the viewfinder for the instrument, and whenever you first start up the instrument, you're going to look at this viewfinder, and you're going to adjust what you see so that you actually get a perfect view or clear view of the printing that's in this instrument. So you're going to adjust this for your vision. So your vision is not a factor in measuring the patient's vision.
I'll show you how to stand.
Okay. If you look at the screen.
You ready?
Yes, go ahead.
Okay.
If you look at the screen, right here it says the right eye. And then that will be an L when you've selected the left eye. This is the number of readings that have been made by the instrument since the last time this number is reset. This is an indicator of how far the instrument is assuming that your glasses will be from the eye. That's a very typical number, that's in millimeters. And then it's telling you it's ready to press the start button to start the process. The rest of the other information is not of value to you. Okay, stop it a second.
Okay.
All right. Oh, yes, it is. Okay. This individual is a little taller than I am, so one thing about it, you have to adjust yourself to accommodate that. First of all, I am going to make sure my elbow is touching this table. I use a board between myself and the patient. Seems to be just about the right distance between the two of us. But the patient is stabilizing himself on the tables also. Now, since he is so much taller, I'm going to turn the eyepiece down, as you can see here. Turn the eyepiece down so that I can get a good reading of it. Okay, come a little closer. Okay, there's his eye. I'm going to move in until that circle of dots is perfectly clear. And then I'm going to press the start button. Okay, then I'm going to go to the other eye by pressing the right left button. And now I've got it showing left. And then I'm going to do the left eye. Now notice that you see that the square is illuminated, very brightly illuminated. And I'm going to go ahead, and sometimes it's hard to find the left eye. There you go. Now illuminated means it's pre-armed. By the way, if I go to the side, up or down, some of those dots get dim. And also if I get too close, the circle of dots gets blurry. If I get further away, it's blurry. The circle of dots, which is the mirroring, must be perfectly clear. Now I'm going to move the square up into the center, and I've got the measurement. At this point in time, if I press the print button, it transmits the measurement over the computer, and the user has a measurement. Okay? Now I'm going to remeasure his eyes, but this time I'm going to do it a little faster and to give you an idea of the speed. And also I'll do one at a time, showing you another option that you can use whenever you're just beginning. That'll make it easier for you. So again, this time I'll measure his eyes at the speed I normally measure people. Okay, 4 dots. Left eye. Okay. Press print. Transmits the measurement to the computer. Okay. Go ahead. This time I'm going to go ahead and put it on channel 2, and you can zoom in this and watch the whole process. Okay. Okay, now it says right OK. And this time I'm going to switch it over to the left side, and I'm going to press the start button an extra time. And you can see it's going to cause that highly illuminated signal to go off. So I'm going to press the start button now. And you said now it says press start button again. So I'm going to readjust it. And so now before you actually allow the measurement to take place, you need to have it adjusted. Now press the start button again. And you have the measurement. Again, press print to transmit it. Okay? That's it. Thank you, Steve. You're on. Now, normally when this patient, a person of this age, is measured, you may have to dilate. How old are you, Daniel? 21. Just about at the age where you would need to dilate the patient. So, but I'll be making the measurement without dilating. So it's possible if I made the measurement several times, I could get several different readings because he's focusing on what he's seeing in the instrument. Okay, and again, I'm going to power up the unit. Make sure it's set to the right eye because it's powered up from the last reading. Make sure it's set to the right eye. And then I'm going to measure. Come a little closer. Get close. There we go. There's his eye. Again, I make sure that I have the circle of dots clear. Now if I go, notice how one dot's disappearing when I go this way. When I go this way, the dots appear, and some of the other ones it starts disappearing. Those 4 dots are necessary to get a good reading on the astigmatism. So you need to have them all visible. Press the start button. Right, OK. To the left eye. I'm not going to disarm it this time. Okay, you go in here. Okay, and then you come up. Notice it's already armed. As soon as it drops into the circle of dots, it's going to start off. Oh, keep your eyes open. There you go. So we'll do it again. Don't blink. Okay, my cell phone just decided to ring here. Okay, go back and we'll do the other eye. First of all, I've got to transmit that one. And you can actually see the measurement on the screen when you've done the transmit. Back and do the other eye. This time I'm going to turn off the instrument. Keep your eyes open wide. Don't blink. And turn off the instrument between readings. You're nearsighted. But that's because you're focusing. That's what you see whenever you have not dilated somebody. It looks like they're nearsighted when they really aren't actually not. Okay, so I'm going to go up. This time I'm turning off the instrument. I'm going to go up, turn it on again, and measure. Got it. Press the print button, it's transmitted across. Okay, cut down. Now this patient has had an interocular implant in both eyes. So there may be some reflections that appear for that interocular implant. We'll see that at the instrument. It's time I'll put my neck strap on like I'm supposed to. And I'll set it to the right eye. And we'll see what measurement we make. Yeah, I can see the reflections on it. You can see a little circle down in the instrument. Got it? It's showing he has good vision, so it's good. Means the doctor did a good job. Okay. Now press transmit to send it in. This time again, I will disarm it between the two so we can see the difference. Now it's much faster to operate the instrument if you leave it armed between the two measurements. Okay, I'll measure them again. Switch over to the left eye. Disarm it. Turns off the start. Now you can see it say start button. Now I can position it without worrying about dropping that thing into the center. Now I got a measurement. I press print, and the measurement is transmitted. Okay? So you can go to the next. Thank you.
What did it say?
As far as the measurement, it told me that you have a little bit of, you're farsighted on one eye, just a little bit. This is fractional. And you're nearsighted on the other eye. You don't have but a minuscule amount of astigmatism left on your eye. Just a minuscule amount.
100?
Yeah, actually this was at 0.50, which is a little less than that. So that was the left eye. Just so you're slightly nearsighted on one eye, slightly farsighted on the other eye.
Yeah.
But by golly, your vision is A-okay.
He told me, he said that the lenses, I can't match them up perfectly, so you're going to be a little bit upset.
Okay, first again, I put the neck strap on, like I'm supposed to, and I set it to the right eye. Now, this patient I've measured him before, I know he has disgustingly good vision. So we'll see how good his vision is now, see if it's changed. Again. Now one thing I want to show you with this patient is the effect of turning left. You see how the dots disappear? And then turn right, dots disappear. You go up, or you go down, you affect the dots. And those dots are very important because they affect astigmatism correction. So we want to have all four of those dots visible. Now also you need to go out, you can go out and in, out and in. You see how the eye ring blurs. When I'm going to go in, so I'll have all four dots and the eye ring is no longer blurry. And then I'll press the start button. Okay? Now reverse to the left eye. A little closer. There you go. Okay, now this time, there we go. This time we're going to leave it armed. You'll be able to find his eye. Sometimes that's the problem. It's there somewhere. There it is. Again, I'm leaving it armed, but notice I'm coming in from below. It is not clear to him yet, but I'm coming in and getting that circle, the two dots on the left and the right, clear, and the mirroring clear, and then I'm going to drop the square, move this one up, drop the square, and it's got its measurement. Okay, and this time I'm going to go back and measure again. This time I'm going to do it by disarming the instrument between the unit. Again, I'm going to make sure that I switched it over to the left eye. By the way, if you look at the bottom left-hand portion of the autorefractor screen, it says right, R-M. That tells you that it's on the right eye. So when we get to his eye, there it is. Okay. Now I need to have 4 dots, so I'm adjusting the instrument until I have 4 dots. I press start. Okay. Get to the left eye. This time we'll disarm it between them. Okay, it's all on the left. And now I'm going to press start. It's actually saying right or left okay. Let's press print. Transmit it in. We'll do this again. I think between those two measurements I didn't press print. Okay, we'll do that again. Right eye. Okay, disarm, and go to the left eye. So there it is. Right, left, okay. Press the print button. Again, transmit it to the computer. Okay? That's it. Thank you, Danny.
Still just as good as it was last time?
Outstanding. Yeah, it is. It's just as good as it was. You know, 0.25 is something that most people, if you wore a pair of glasses that were 0.25 as far as cutting, you couldn't tell it wasn't clear glass.
Oh.
Okay, so there's no reason to ever give you glasses as long as your vision's like it is. Okay?